Hey everybody, Dr. Vince Gutierrez here. You can find me at movementthinker.org and you can find me on podcast at NVivoPT. So there was an exercise that I came across and I'd never heard of it before, right? It's a patient ankle injury and the exercise is called nose to wall touch. Never heard of it phrased like this before. So if you see this exercise out there, just know that this is what they're talking about. And it's actually a pretty good exercise. So it's a closed chain, meaning feet are on the ground, okay? And you're moving your body around your foot, not your foot around your body. So it's a closed chained exercise to work the plantar flexors, the calf muscles, the gastrocs. Yeah, they get huge, the bulls, instead of the calves, the bulls. Anyway, old Arnold joke. Anyway, so it's a closed chained exercise and it can be progressed in a few different fashions. And so I'm just going to show one way of doing the exercise today. So we'll make the pretend that I have a right calf injury or a right Achilles injury or a right ankle injury, and I am unable to actually perform a heel raise. I actually tore this one. I fractured my ankle, so there was a period of time where I couldn't do a heel raise. And so for those who may not be able to do this, this is another option to get the gastroc muscle, the soleus muscle working together. Again, make sure that you're under somebody's professional care when doing this. This is not treatment advice. This is an option for performing an exercise. So what you would do is you'd have your feet fairly close together. It's called nose to wall touches, and I gave this exercise today, which is the reason why I'm covering it now, because I told the patient to touch your nose to the wall, and this is what the patient did, right? This is a hip hinge. That is not going to work your calves. Your bulls, never mind, moving on. So this is not going to work your calf muscle. So what you have to do is you have to get your body to angle forward so the weight shifts towards the ball of your foot, and then you pull yourself back. Okay, so when I gave the instruction to the patient after saying touch your nose to the wall, I said try to get your belt line to move closer to the wall. And the patient did one of these numbers and then backed off. Did one of these numbers and backed off. A progression of this is just increase weight bearing, right? Because then you increase the amount of load that moves around the ankle joint. And so you can do that just by kicking the other foot back, move your belt line towards the wall, back off, belt line towards the wall, and back off. And now the affected leg would have to support more of your body weight. So these are options that you can use, closed chained, very safe, effective for getting that muscle turned on, effective for getting that muscle to contract if you don't have the ability to contract it in an open chain where you're doing heel raises. Thanks for watching.